welcome back to my YouTube channel. My name is Lola, and if you're a returning subscriber, thank you so much for coming back and for sticking around. If you're a new subscriber, thank you so much for loving on us. In here, rather, thank you so much for choosing and for deciding to join the family. All right, so if you are yet to subscribe, please click on the subscribe button and on the notification bell before we go on. And I am just going to first share my delivery story, and then I will also talk about you know just the controversies and um the differences between delivery section and cesarean section and vaginal delivery. All right, so first off, I'll start by telling my delivery story when I gave birth to my baby, who is now a toddler. All right, so then I was overdue already. I was about 41 weeks, and my midwife told me that I would need to come in for induction. And mind you, I had tried everything. I did exercise, I drank a lot of water, I did all that, but yet, the baby was, I had no sign. There was like no contraction, there was nothing happening. All right, so the first thing my midwife said was that I would need to come in for an induction of labor. Okay, and so she said that if the induction of labor fails, then we would now proceed onto cesarean section. So I'm like, okay, no problem. I mean, she had examined my cervical os was still closed and everything. So she asked me to come a day before my delivery, which I think was a Monday. So I went, and then she passed the balloon just to, for you to understand better, just for it to assist in the opening of the cervix, kind of. So the way it is they passed like catheter in, and then they inflated the balloon, just for it to help the cervix to open a little bit and to see if that will initiate contraction. So yeah, she passed that, and then on Tuesday morning, so I went into the hospital, and I was on the bed. They put me on the bed, and they said I wasn't going to walk around. So of course they checked the blood pressure, they checked like everything, and then they were monitoring the fetal heart rate as well, and how the baby was doing. So I had like almost all the gadgets on me to monitor how the baby was doing while they were trying to induce the labor. So the first thing they did was that they passed, I had like the injection, which I probably might not be mentioning all the details of the injection in here, but they passed that via the infusion fluid, and I got that, what people call drip. So yeah, I passed that, and I mean, I was getting that, and gradually I started getting some contractions gradually, like I said. And also at some point, for the painkiller or for the pain relief, at first I was given the nitrous oxide, which was not really working. I was given morphine injection twice, which was not catching the pain. The pain of being induced actually was much more than I don't know how the normal contraction without, or normal delivery without being induced, I don't know how exactly it is, but I learned that the pain is actually, and this pain is out of the world. So eventually, when morphine was not catching the pain and they checked me, the baby was all right from the entire thing, from the monitoring, and also my blood pressure, everything was okay by God's grace. So they checked, and they saw that I was dilating very well. So I was given, so they asked if I would be having an epidural, which I said yes. I don't mind at this point, because the pain was out of the world and it was tiring. And this was like, I think everything happened within like 12 hours. I was there for like 12 hours in that intense pain. So by the time it got to about 4 5 ish in the evening, they were like, okay, they were going to give me epidural, which made the pain subside from 100 to 0. Okay, but I was feeling the pressure, like something wanted to come out. So at some point I was telling my midwife that, I feel like I want to have a poo. So that was when she knew that, oh, the baby is ready to come. And then she examined me and said that she could see, the baby trying to come out. All right. Like I said, I was still having a contraction and everything, and there was like adequate monitoring going on. So choosing to go that route was based on their own inferences and what they had examined, and they had seen that I was capable, or my body was capable of going through. All right. So that's just to give like a story of what happened exactly, and to tell you that it's not just you going into the hospital and just being in the position to give birth and then your baby pops out. That is not the only way by which you can give birth to your baby. There are different methods, especially in developed countries, that you can use. And that is just to say that when you're choosing a place to have your baby, please make sure you are confident in their competence. Make sure that you know that even if emergency arises, they can handle it. So that is not the time for you to start running everywhere. I mean, yes, it might be on the high side when it comes to money, but then would you rather choose your own safety than consider money? Okay, so I think that is one of the very first thing I want to talk about when it comes to choosing delivery methods. You have to consider safety all round and ensure that the people you are choosing or the facility you're choosing can handle whatever arises. Yeah, so yes, I you are trusting God, I'm trusting God, but please, safety for yourself and for your baby. I mean, this is like the last lap of your pregnancy. You don't want to make choices that you will not be happy with yourself at the end of the day. Okay, so yeah, and this is not a choice that necessarily people have to choose for you. These are like the discussions you need to have with your spouse before you get married. Not an external person now telling your husband what to do, not family members calling him that, oh, this is, we don't do this in their family and all of that. You need to be wise when it comes to your own health, your own life, because at the end of the day, this is your life on the line, actually. Because I don't think delivery is one of the, I feel like the delivery process is one of like the underrated. Is it underrated? I'm not sure. But yeah, it is one of the processes that need to be paid attention to with like like critically. Yeah, that's what I want to say. You need to pay attention to it critically, and it starts from you. Your medical doctor can make suggestions, but if you say no, they can't go beyond your consent. They need your consent. So at the end of the day, everything still comes to you. So now let's talk about what are the advantages of having um cesarean section. Let's talk about, okay, let's first talk about vaginal delivery. That is when you deliver your baby vaginally, okay, and you didn't have to go through the process of getting an operation. So what are the advantages? One of it is that the recovery process is faster. Okay, like it's faster for you to once you deliver your baby, probably you had episiotomy, maybe one or two sutures, you're done, and then you have your baby. In most cases, the recovery is faster. Let me put it that way. You have your baby, and then they start initiating breastfeeding, and processes of you bonding with your baby start immediately. They put your baby on your chest, you're able to carry your child and all of that. And that is it. Secondly, I mean, cost wise, probably in some country where you have to pay for everything, in terms of money, it is more economically effective. You don't spend so much on as much as you would have spent probably if it was cesarean section. So yeah, that is another advantage. And another advantage is that out of the um delivery room, almost immediately you start eating. Everything like commences almost immediately. That is according to how you are able to bear it, according to how you are able to manage. Okay, it is not dependent on, oh, a particular medication you use during surgery, you're not allowed to eat yet, or probably a complication that arose during surgery and all of that. Like everything almost starts almost immediately according to how your body is able to like adjust. Because for me, I think after the baby, I slept off. Like I've had, like, I was in pain for like 12 hours. I just wanted to sleep. Everything in my head right at that time. I mean, I was excited, but I was tired. I wanted to sleep. So yeah, and the following morning I had something to eat, like fast. So yeah, that is one of the advantages, of having the vaginal delivery. And yeah, so also vaginal delivery also reduces the risk of a lot of infection that you could get, via or a lot of complications that could arise from cesarean section. Vaginal delivery reduces that probability of any complication arising, if you get what I mean. Like, a lot of things could arise from cesarean section. There could be, blood loss. There could be like maybe a blood vessel rupturing, and it was taking a bit of time for them to rupture, to suture back, and all of that. And probably we've had cases of probably trying to um the doctor probably you know just issues. I don't want to be talking about legal issues here, but yeah, having vaginal delivery reduces that risk of having medical and surgical complications. And disadvantages, there are also complications that could arise from vaginal delivery, in the process of probably trying to pull the baby out. There could be dislocation of joints and everything. And yeah, and there are also like um some issues that could arise from maybe probably spending a lot of time in the birth canal, such as asphyxia. Like, they could like develop low oxygen, and just a lot of complications also could arise. But I mean, it is much more lesser. And once your doctor has checked you over and are certified that you can have vaginal delivery, by all means, with monitoring. And that also goes back to ensuring that your hospital has everything in place to take care of you, and also ensuring that you attend all your antenatal classes, so that if anything arises, they could pick it up early enough, and they could pick everything early enough, so that they can determine which mode of delivery would be suitable for you. So yeah, that is everything I want to really talk about. But I don't want this video to be a long one. So the next one I want to talk about is the cesarean section, which obviously is like what most people in developing countries don't want to hear about, or people with religious mindset, or people with probably just controversial mindset don't want to hear about. And I want to tell you that cesarean section, if it is done by people that are capable, I don't want that are, if, like I said, be sure that you are in good hands. Okay, be sure that the doctors handling your cases, they are the specialists, not hospitals that probably use a cardiothoracic uh whatever. Now, yeah, I don't want to talk about that. Just be sure that the person handling your case is a specialist, people that have knowledge about ups and gynae, people that have knowledge about taking care of pregnant people, delivering babies surgically, and all of that. That reduces a whole lot of anxiety, worry, and risk on yourself and on your baby. Okay. And if your doctor has examined you and has told you that the best bet is going surgically, please and please, for the safety of yourself and your baby, please agree. Okay. Don't think that somebody somewhere is making a decision for you, and at the end of the day something happens, and then you are just the one crying, because they can't feel what you are feeling. Actually, nobody is to make that decision for you. It is your life, and you should be able to stand up to yourself and make the decision for yourself and your child, which at the end of the day, when you see your child, you'll be happy you made that decision for them. For your child, you are there, your baby is healthy, everybody is fine, the family is complete. Okay, what you have carried, the baby that you've carried for like 40 weeks, and at the end of the day somebody's making decisions for you. I don't think that is all right. I don't think that is wise. I think the best thing is for you to make that decision that concerns yourself and your health first. Okay. And that's also to say that, before you even get pregnant, please make sure that financially you know what it takes, to take care of everything that occurs with pregnancy and all of that. A lot of people just probably just prepare for clothes, shoes, and everything, and they prepare for probably the party that happens. I mean, from where I'm from, you just prepare for the naming ceremony and everything and the christening, but you're not preparing for the delivery. That is actually a very big mistake you are making. You must be sure that you yourself and your child are all right before you even plan all of those secondary things, because they are secondary. We've had children that they gave them names, they christened them actually in the hospital, and nothing happened. No heavens fell. Okay, I mean, nothing happened. They are all right, and nothing happened to them. Okay, so yeah, back to what I was saying, cesarean section, is one of like and if it is performed by a specialist, it reduces the risk and the complications that could arise. And what else? It is like the pain that you experience is much more lesser that of than that of vaginal delivery, because obviously the pathway, the pain pathway and everything has already been overridden, by the surgical procedure. So you don't have to go through that pain of contractions and labor, and then they just get your baby out. And thank God for the advanced technology now. They don't have to necessarily use general anesthesia where you are put to sleep. I mean, probably for some reason they could go that route, but for most of the cases that I'm seeing right now, you don't have to go through that. We have the epidural where, it just, you are awake while the surgery is going on, and you can have your baby on your chest for the mother to child, skin to skin bonding immediately after your baby is out. So you still have a plus in that side. Okay, so yeah, it's less painful, it's less stressful, and less emotionally draining. Okay, and you have your baby. All right, and let's go to the disadvantages. Obviously, that is one of the reasons why most people don't want to opt for cesarean section. There is high risk of medical and surgical complications. That is why you have to be sure of who's handling your case. Also, the fact that probably a lot of things have to be put in place before your like activities of daily living have to start. Like, probably there might be a time range for you to wait until you start eating, until you can stand up and walk, until you can like commence what you do normally. And for instance, when I had epidural, I didn't stand up immediately because obviously I couldn't feel anything from here till down. And I think later on I was able to like start, but it was not immediately. So that's to say that you might need assistance with probably walking and doing all these things probably for the first few hours. Okay, and then economically, it is more engaging in terms of money. You have to spend more, especially in a country or in places where you pay like for everything. You have to spend more, and it is more I mean, it puts more it is more energy and mentally tasking for family members, for loved ones, for people, for your birth partner, for your husband. Everybody is really, really anxious about what's going on in the theater, even after surgery, especially in places where you have to get everything yourself. You are running around to get this and that, ensuring that everything is in place, just all those things. But I feel like if you are well organized, if probably you have signed a consent, ahead of time, all these things are already in place, there is no reason why it should be that draining. And even if probably you have been told that you are going to have like a surgical, like you are going to have vaginal delivery, and on that day something happens, you have to go into the theater. These are the certainties or uncertainties that you have to prepare for, just in case this happens. This is where this is. You have to educate your partner. You have to have planned for everything so that there are no surprises. Yeah, and eventually the most important part that you need to take out of this video is that it is for your safety, and it is for the safety of your baby, and which is the goal. This is the reason why you've carried this baby for 41 weeks or for 40 weeks, for this baby to be safe. So please, if the last lap of this journey is for you to consent to a cesarean section, I beg you, please do not hesitate to sign the consent form. It is for your baby and it's for yourself. I hope you've enjoyed this video, and I hope that it has also, encourage you to make that hard decision. I know it is hard. I know, you're scared and all of that, but it is at the end of the day for the safety of yourself and for your baby, which will make you happy. at the end of the day. Thank you so much for watching this video till this time. If you have not subscribed to this channel, please do so before you go. And if you have subscribed, thank you so much for supporting your girl, and I will see you in the next one.